COVID-19 crisis, and we will get through it one day at a time. So thanks everybody for what they're doing. Let's take a quick look at where we're at. As we've talked about repeatedly, we expect confirmed cases to continue to rise as there is more testing out there and as there is more community spread as well. And so that is the case with the numbers today. There are 206 positive COVID-19 cases here in Jefferson County. I want to very sadly report that there are 3 additional deaths since yesterday, and Dr. Moyer will give more information on those. There's also one earlier death on March the 23rd that we now know was due to COVID-19. So we have lost 7 people in our community to COVID-19 since this crisis started. So that obviously is tough to digest for folks, especially for the families that this has affected. And as we all ask ourselves what we can do, think about that loved one that you don't want to lose. So our hearts go out, obviously, to the families that have been impacted to this with these 7 deaths. So I'm very sorry to hear that on behalf of the community. When you take a look at the numbers today, today's case count of 206 is an increase of 43 over yesterday. And then we saw an increase up from 23 the day before. So over these last few days, you're seeing this increase in number of cases. And for the most part right now, that's because labs are catching up. But these lab tests are not the full indicator of the full extent of the COVID-19 in our community. So this obviously is a lot, but so far we haven't seen the kind of explosive growth that you're seeing in some other cities right now. We saw it when it started on the West Coast in Seattle, and then on the East Coast in New York, which currently is the epicenter for the country. And now it's coming into the heartland. Detroit is really getting hammered right now. Chicago is right behind them. And then Indianapolis has been identified as a potential hotspot. And then right across the river, the chief medical officer at Baptist Health Floyd in New Albany said that Floyd County has the potential to become a COVID-19 hotspot. So obviously this virus doesn't know any kind of geographic boundaries. So we all have just got to keep doing our part to keep our social distancing in place. And this, hopefully, this lack of exponential growth, while we're having big growth, it's not exponential. Hopefully what that's showing us is that what we are doing with social distancing is working here in Louisville. And there's a new report out that demonstrates we think that we're making good progress here. I don't want to hang our hat on any one of these, but these data sources are coming in saying our social distancing is working comparatively well. So a company called Kinsa Health produces smart thermometers, and they've created a map of the United States according to where the thermometers are recording fevers. And Kinsa has been able to identify trends in where the disease is going. So they can compare areas looking at places where strict social distancing guidelines are in place versus other areas that haven't employed social distancing. And what they're finding is social distancing does save lives. Okay, that's been our theory from the beginning. And that's the theory of anybody that's been trying to defeat pandemics before. There's a story in today's New York Times that breaks down the data, and it quotes Dr. William Schaffner, a preventive medicine expert at Vanderbilt University. And he says, based on the fever map, it is clear that it takes the most restrictive measures to make a real difference. Let me repeat that. It takes the most restrictive measures to make a real difference. So what that means is social distancing. And what the data is demonstrating is that social distancing works, staying at home works, keeping 6 feet between yourself and other people out in the public, that works too. Okay, so all this stuff comes together, combined with the other things we've been talked about, like washing your hands regularly for 20 seconds. All of it works. Okay, so we just got to keep doing it. This is a marathon and not a sprint. And what we're seeing is these results are helping us not have the exponential increase. And I hope and pray that continues to be the result here for our city. But everybody in our city has a role to play in this by practicing social distancing. Okay, we have to do more, even though we're doing a good job right now. And I fully support what Governor Andy Beshear announced last night with travel restrictions. Our governor's doing a great job giving good information in a calm and informed way. And it's working, and we just hope that it continues to work. So with the travel restriction order, if you don't absolutely have to travel to work or for work or medical care or to care for a loved one, don't travel. Okay. The more we all stay home, the safer we're going to be, and the sooner we're going to get through this COVID-19 crisis. Okay. So just, I find that, going through this is somewhat like building a skill, right? I mean, you start restricting your movement, you get used to that, you do it a little bit even more, you start developing new routines and new rhythm. And then you say, okay, I can do more now. That's what this travel restriction is all about. So please do not travel unless you absolutely have to, and it's an emergency, or you have to get to something essential like work. Okay. Let's transition now over to the financial side. You've heard me say many times before that we're fighting a health crisis, but we're also fighting a financial crisis. And once this health crisis is over, we're going to still be working through the economic impact of COVID-19 for quite some time. We're not waiting for it to be over. We're working right now to help address the serious needs of our small business community. We've talked several times in this medium here about the $2 trillion federal relief package that has provided support for individuals and small businesses, and that is really great. But the truth is that not every business, particularly many of our small businesses, have the reserves to wait until that help comes. So the question is, what do we do between the interim when we had to shut down businesses until the federal relief comes? According to the Wall Street Journal, most businesses only have 15 days worth of cash. And so that 15 days has gone by very quickly in our community. And this is another area where the community is really rising to the occasion. We've seen that with our One Louisville COVID-19 Relief Fund. And we've been wanting to put such a relief fund in place for our small businesses. So that's why I'm happy to announce here today a new resource specifically for our very small businesses. It's called the Small Business Continuity Loan Program. This program is designed to help our smallest businesses, which we define as those with 10 full-time employees or less. And it's designed to help them get through this state of emergency when many are facing closure or severe limitations as a result of the COVID-19. So these qualifying businesses can receive a loan for up to $25,000 at zero interest for 12 months. So again, they won't have to make any payments until that 12 months is up. And so you can learn more about this on Louisville Forward's webpage for small business. So go to louisvilleky.gov/Louisville Forward. Louisville Forward is our economic development agency. Once again, it took a lot of people to come together to make this happen. Our community does that all the time with the great partners we have. We have close to $1 million committed already. I'm sure that's going to grow. So I want to thank some of the folks that have worked so hard to pull this together. Amy Shear and the great team at El Home, they will be administering the local loans. Access Ventures, Thought Partner, thank you, Bryce. And it's Regional Fund, Render Capital. Lender Fit, which is providing the local loan application software. And then donors like Endeavor Board Chairman Brooke Smith. Thank you, Brooke. You're doing a lot of good in the community. And big thanks to Bryce Butler at Access Ventures and Sarah DeVasher Wisdom of GLI for helping to raise the private dollars. Bryce Butler and Access Ventures are one of our great social impact investors in the community. And social impact means that, yes, they're trying to make a little bit of money, but they're trying to make a greater social impact as well. So those two are not mutually exclusive. And Bryce worked really hard on this along with the rest of the team. I want to thank Mary Ellen Wiederwall and Rebecca Fleischaker and the team at Louisville Forward for the work they did, and the board of Louisville Metro's longstanding small business loan program, which you might have heard of, we call it the METCO loans, METCO, and because we have provided $500,000 toward the Small Business Continuity Loan Program. So applications will open through El Home on Monday, April the 6th. And then I'm joined now by Jennifer Rubenstein. She's the director of the LIBA, Louisville Independent Business Association. Jennifer's been in the trenches with small businesses here in Louisville for a long time. So, Jennifer, if you tell us what you're hearing from our small businesses, I'd appreciate it. Jennifer.
Sure. Yes, we are a Louisville Independent Business Alliance, and a lot of folks know us by our Keep Louisville Weird campaign, our Buy Local Fair, et cetera. We have close to 900 business members. All of them are tied together in that they're local and independent, and the vast majority of them are very small businesses. So they need cash. They need a bridge to weather the storm. So we're really grateful to have this additional tool in our toolbox, and we'll definitely be adding this to our educational resources that we have on our webpage, as well as other ways of publicizing it. We're very glad that we have another way that the city and that all of these partners have come together to make sure that our small businesses, who really contribute so much to our sense of place and our community character, can get the means that they need to weather the storm.
All right. Well, let's keep working at it. I know it's been tough times here, but it looks like, help is on the way, at least locally and then federally as well. So I'm also happy to be joined here today by a small business owner that would qualify for this loan, and that is Terry Ross and her fabulous store 50 Lou on Frankfurt Avenue. Terry, I like the T-shirt that's on your website there that's got the big letters, social distance, but then in real little letters it says, if you can read this, you're too close. So that's definitely sending a good message. So Terry, what's on your mind here as a small business owner?
Actually, it's because we've never done this before. We've never gone through this. Growth. We're still managing, trying to figure out, what we can do personally, because every case is going to be differently, to help mitigate going into debt. Because we're fortunate we don't have any debt other than our payroll and our rent. But I only just closed on a building the 27th of February. So you know who I called on March 10th with my mortgage lender saying, can I have forbearance or at least interest only or something? And they were gracious enough to do that. So you have to, if there was something concise, that's what you needed help with, is something concise to say, do these things first to help yourself, and then map out, make a plan. There are a lot of people that I know that are in small businesses that are looking maybe from retiring or moving or doing something a year from now. They're forecasting for another year that maybe they might want to rethink and say, maybe we should do that now, if we can, and then alleviate any kind of debt before they do that. You have to look at your own situation. And if there's not any guidebook for that, and then when you're going to be still out there trucking and may not even be in the same place or location, you might even start looking at scaling back just to survive, But my last step would go to getting any kind of debt. That would be my last ultimate. Once I've gone through all my own resources, ever how long I can go, then the last step would actually be debt. If in fact grants are not even, that's not, tolerable, and there's not enough money for grants or out, and who would you choose to grant some and not others, because everybody's going to be in that line. But in the meantime, the last place I'd go is to start borrowing money, even though it's an excellent opportunity, the zero interest, zero payment. If we don't have if this goes on for like 4 months and it takes us another 4 months to recoup back where we were at 4 months and another 4 months, then we're still looking at the end of a year having to pay. Our prices are definitely, those $22 t-shirts are going to end up being 24.
Yeah.
They're going to have to, everything's going to have to go up a little bit to pay for all that.
Well,
so that's my guess.
Yeah, at the end of the day, that's how we're going to have to work our way out of this hole we're in right now. There's no magic to it. But thanks for the advice you're giving everybody, and love Frankfurt Avenue, of course, is a beautiful, flourishing area of our city. So thanks for helping us today and giving your perspective on how to get out of this crisis. So hang in there, and congratulations on
we will. I have a new shirt coming out next week that's really going to be funny. It really is funny.
All right. Little teaser there from Terry Ross on her t-shirt. Be looking for it. All right. Thank you.
Thank you.
Yeah. Okay. So, and then Mary Ellen Wiederwall, who's our chief of Louisville Forward, is on with us right now. If we have any questions for that later from the media, she can handle those for us. All right, let's go into another area that's been a great concern, and that's making sure that we have adequate personal protective equipment, or PPE, for our first responders, for all the folks that work in our healthcare facilities. So to get through the crisis, we got to have more PPE and medical supplies for our health professionals and our first responders. Today, I joined mayors across America in calling for the federal government to take the necessary steps to make that happen. And so the United States Conference of Mayors, of which I serve as vice president, sent a letter to President Trump urging him to fully enforce the Defense Production Act to mitigate the worst impacts of COVID-19. And so the Defense Protection Act enables the president to direct private companies to contribute needed resources to respond to a national crisis. So much like you've seen him do with General Motors and increased ventilator situation. So folks, if there was ever a national crisis, this certainly qualifies as one of them. 500 dead yesterday in America, and the trends are not looking good for us right now. So we've got to do everything we can to stop the virus. Now, we have seen many companies step up without being told to step up at the same time. I'm really proud of our local bourbon industry, our distillers that are innovating to produce hand sanitizer here are one great example of how companies have stood up and done the right thing. But more companies need to join in and produce masks and ventilators and other equipment and gear that are absolutely essential in this fight. So we, the mayors of America, really urge the president to enforce all the powers of the Defense Production Act to immediately save lives and protect the people on the front lines of the war with COVID-19, and then shorten the duration of this crisis so we can get through it. We just got to do everything we can as a country right now to defeat this virus and save as many lives as possible. Okay. I do want to say too that when we're going through times like this, times of struggle, is when you see people really step up and show their heart. Could be companies that are doing it. So today I want to thank our businesses that are doing the right things. And there's a lot of you all out there. And that includes many of our phone and internet service providers who have made their services available for children and families who really need a way to connect to the internet since schools have been closed and their homes don't have internet access. AT&T, for example, is offering 60 days free broadband internet Wi-Fi services for any family with children who receive SNAP benefits, so food stamps, or free and reduced lunch at school, or they are enrolled in Head Start. And T-Mobile and Sprint are waiving all data caps on cell phones, and their customers then can use their phones as Wi-Fi hotspots for free. And so thank you to AT&T, to T-Mobile, and to Sprint. And today I'd like to give a special shout out to Spectrum. Earlier this month, Spectrum announced that they'd provide 60 days of free broadband and Wi-Fi services for students whose families don't currently have an internet connection. And now they're going a step further and extending that offer to teachers as well. So teachers who don't have internet access can get 60 days of free access to broadband, internet, and Wi-Fi. So thank you, Spectrum, for stepping up that way. Good job. Obviously, having access to the internet these days is like you need to have water, you need to have electricity, you got to be on the web to stay connected and learn and apply for jobs and stay in touch. So thank you to all these great telecommunication providers for our city. Nice job. This is more important than ever because JCPS is getting ready to start their virtual classes next week, and it's things like the actions from these telecommunication providers that will help us make sure that every child and every home is connected. We don't want to leave any child behind. Tomorrow, I'll be joining Dr. Marty Polio, the superintendent of JCPS, with more information on how we're making sure that all of our students have the tools they need to fully participate when they're not physically present in school through online connectivity. So again, Thank you to all of our internet providers for stepping up to accommodate the needs of this moment. As I've said, we need everybody to do their part, every individual, every business as well. So thanks everybody who's helping out right now. Speaking of a group that's helping us out, our grocery store folks are really rising to the occasion. They are not only selling a lot of stuff, and the grocery and food supply chain is in good shape, as we've talked about before, and as you're seeing when you go to the store, but our grocers are taking other actions that they need to take. They're putting up plastic shields at the checkout, putting tape on their floors to create social distancing for customers, offering special hours for our elderly and residents with health conditions. So I want to thank them for doing that. Now, we're having some challenges, though, in our grocery stores and some other retail outlets that are still open. And that is people are getting too close together in the checkout lanes or in other things. So remember, you got to keep 6 feet apart when you're at the grocery store as well. So I urge everybody when they're going to the store for food and supplies, practice that same social distancing. You'll get through the store just as quickly with your fellow customers and with the staff as well. That's how you're going to protect yourself. It's going to how you're going to protect them as well. And in so doing, you limit the spread of the virus in the community. Also, try to limit your trips to the store. So you don't have to go every day. Try to say, how can I go once a week? Because the more we stay home, the safer we all are, and the sooner we get to the other side of this crisis. Okay, so just think about how you put this all into your daily and weekly routine. We continue to get good advice from our Public Health and Wellness Department on that every day. And today, the Director of Louisville Metro Public Health and Wellness and our Chief Health Strategist is joining us to share today's tips and information. So Dr. Sarah Moyer will take it from here. Sarah?
Thanks, Mayor. So as you mentioned, our cases of COVID-19 are rising every day. We did expect this. Our increase in deaths over the last day reporting all 4 people were in our high-risk categories of people over 60 or with chronic medical conditions. And so just really pushing that message that everyone needs to be staying home except those that are in essential job positions that we rely on you to be at work for. The cases and death numbers that we see today reflect how good we were doing at social distancing about 2 to 3 weeks ago. So how we were doing 2 to 3 weeks ago is what we're seeing in the numbers today, and we'll see that moving forward. As more people are being tested positive for the virus or will be identified as close contact to someone with COVID-19, that's what the advice I want to give today. So everyone, every time you're going out, you should be acting like anybody you come in contact with has COVID-19. So keeping that good 6 feet of distance. Don't touch anything you don't have to touch. If you do touch something, make sure you're washing those hands, especially before you eat or touching your face. As our cases rise, more people are going to be ordered into home isolation. All of us should be staying home, as I keep mentioning, and only going out for necessities like groceries or medicines. That's what self-quarantine is. Home isolation is even a little bit stricter. If you're ordered into home isolation, you'll need to make other arrangements for groceries and medicine. And if you aren't able to have a friend or a family member that can help with this, the team at Louisville Metro will help get you those things that you need. So if you test positive for COVID-19 or are diagnosed with it, or you're identified as a close contact of someone with COVID-19 and are ordered on home isolation or quarantine, I'm going to give 10 tips today of what you should do. So 1, just like everyone's doing, you must stay home. And if necessary, if we find that you're not obeying this, we will enforce home isolation with legal force. So please don't make us do that. It's not something that we enjoy doing. It's okay to get some air on your deck or in your backyard, but stay by yourself. You need to stay home from work and school and away from other public places. You also need to stay home from other family members and isolate in a bedroom or someplace alone if you can. Every day you should be monitoring your symptoms carefully. If symptoms get worse, I need you to call your health care provider immediately. Get plenty of rest, drink plenty of fluids like water, sports drinks, take Tylenol to manage those fevers and aches. And remember that there's some evidence that ibuprofen can make symptoms worse. So we're recommending Tylenol right now until we know more data. Be sure to follow the dosage on the bottle and don't take more than it says. It can really damage your liver if you take too much. And if you have heart or kidney problems, please check with your doctor just about how much fluids that you are able to take. Don't just chug lots of water because I told you. So please check with your doctor if you have heart or kidney problems. Step 4 is continue to cover your cough and sneezes with your elbow. Step 5 is to wash your hands often, even when you're at home, with soap and water for 20 seconds. If you can't wash your hands, cover your hands with an alcohol-based hand sanitizer that contains 60% alcohol. Step 6 is, as much as possible, stay in a specific room and away from other people in your home. Sleep in a separate space from your spouse or partner. Use a separate bathroom if you have one. Have someone bring you food or drink to your room and leave it outside the door. And if you must be around other people in your house, wear a face mask. Step 7 is avoiding to share personal items such as dishes, towels, beddings with other people in your household. And step 8 is to clean all surfaces that are touched often, like countertops, tabletops, doorknobs. Use household cleaning sprays or wipes according to the label instructions, or you can make your own COVID-19 cleaning spray with 1 part bleach to 9 parts water. For small batches, this is about 1/4 of a teaspoon of bleach to 2 cups of water. Step 9 is postponing all non-essential medical appointments, really anything out of your house. If you've got a critical medical appointment that can't be done virtually, or if you are getting more ill and need to go to the hospital or the doctor, call your doctor's office ahead of time and tell them that you may have COVID-19, and this will just help them prepare and protect themselves. And then if you have an emergency, 911 is still there. Just notify the person that answers the phone that you have or may have COVID-19, and this is to protect our first responders so they wear the right equipment and not get sick, and they can be there for the next person when they need them. So those are the 10 steps. We at the health department will be calling you every day just to check in, and we'll let you know when it's time to be released from self-isolation using the criteria that Dr. Kaloya mentioned yesterday. Usually it's about 14 days, but you have to be symptom-free for at least 72 hours. Just want to also add that I'm really appreciative of what people throughout our community have been doing to practice social distancing over the past few weeks. This is the most important thing you can do to keep our essential personnel who can't stay home right now, our healthcare workers, our first responders, utility workers, cleaning crews, and everyone working to make sure we have enough supplies, working appliances, and food to stay home. So thank you. This lets us go to work and know that hopefully our community is healthier. I know the rest of you are getting a little stir crazy. My kids certainly are, but now's not the time to let your guard down. Like the mayor said, COVID-19 is moving towards us from both the west and the east. It's hitting Indianapolis. Cases are getting high all around us, and that will be here soon. It'll be much better if we keep up this great social distancing. We're all in this together. Let's all stay in our homes and only go out once a week for medical necessities like food and medicine. And if you're ordered to home isolation, practice the 10 steps I've outlined. You can find them on our website. And we can do this, but we really do need everyone. So thank you. Really appreciate how the community is coming together for this. Thanks, Mayor.
Okay, thanks, Dr. Moyer. Appreciate your all's good work. So a couple closing comments, and then we'll go to our media questions. So just want to close with some things we're doing on Lift Up Lou. So you'll remember that Lift Up Lou, so liftuplou.com or at Lift Up Lou, was designed to keep the morale of the city up and all of us connected, and they're doing a great job with that. So tonight at 7 o'clock, there's an online session on mindfulness called What is Mindfulness? There's a lot of questions out there about that, and it's put on by Happify. Happify is a company that uses science and technology to promote mindfulness and happiness. Who can be against mindfulness and happiness, right? So check it out. If you've been wondering about mindfulness, there's no better time to learn or apply these great principles, and this is a great introduction. So tonight at 7 o'clock, follow at Lift Up Lou on social media, and there are multiple activities going on every day that can be part of your daily rhythm. All right, so we've talked about the need to stay strong and physically fit and mentally fit as well. And if you're having any kind of struggles with mental health challenges of the epidemic, it's only normal to feel a little anxious right now. Remember to reach out to friends and families. We're all sharing a common experience, and we'll have many different perspectives on it, but you can also talk to trained professionals. There's a crisis counselors for free through the disaster distress helpline. You see it on the screen right now. They can help you deal with stress, anxiety, and depression symptoms related to COVID-19. So you can call the disaster distress helpline at 800-985-5990 or text talk with us to 66746. So we want you to be healthy both physically and mentally as we get through this COVID-19 challenge we got in front of us. For the most part, we're rising to the occasion here in Louisville. So let's keep at it. Got to stay strong. You know, we don't know where we're at in terms of this game being over, but we know if we're strong every step of the way, we'll be in much better condition. All right, we'll go to our media questions right now. There's a couple questions in here about GE appliances and the status of the facility out there. So I can report that we have 2 inspectors out at the facility this afternoon. They have not come back yet and have a report. So we'll have more information on that later. But GE is classified as an essential business by the state of Kentucky, Department of Homeland Security. So that's why they're able to operate right now. Obviously, the plant has to be in the proper condition from a social distancing standpoint, and then management and the workers have got to agree that, okay, it's time to get to work here. So that's the kind of process that's taking place right now. So there'll be more information on that tomorrow. This next question is from Jesse Cohen. I'll throw it to Mary Ellen Wiederwall. She's our chief for Louisville Forward. And Mary Ellen, the question is related to the new small business continuity loan. How crucial is this program to keep our local shops alive? Louisville thrives on these type of small businesses. And can you explain further how this will directly help them get back on their feet?
Well, you've hit the nail on the head there about our small businesses and what makes Louisville special and helps us thrive. Y'all know small businesses are a really big part of our economy, but it's also what makes us weird, Jennifer Rubenstein. It also makes us really special and authentic. And these very small businesses with 10 or fewer employees are really the ones that are, in this case, probably the hardest hit by what's going on. They're less likely to have savings. They might not have access to capital. So we're really excited to be able to partner with the groups you've mentioned and administered by L Home to deploy this capital quickly. The big package that was passed by Congress last week and signed by the president is going to provide relief for a lot of different small businesses. Of course, the Small Business Administration defines a small business as anything smaller than 500 employees, which most of us think is a pretty big business. They might have more access to capital depending on how big your business is, how long you've been in business, and of course, what kind of business you are too. The businesses that have been most impacted by the executive orders and the closures, those are the ones we're really worried about as well. We also refer to them as our Main Street businesses. And so this is, with our partners, an attempt to really get that capital out on the street quickly, keep them open. And that's why we're calling it a continuity loan. We don't want to lose any of those small businesses while we wait for other capital to be deployed and for the economy to rebound.
Mm-hmm. And what would you say, Marilyn, how this fund and then the federal relief fund, and if I am a small business and kind of want to walk through what my options are, where should I go to check that out?
We produced on our website, which is louisvilleky.gov/Louisville Forward, a Q&A document that you can walk through that asks those questions from a small business perspective. And it will tell you what kind of grants you're available for. There is a grant program as part of the federal act, what kind of loan programs you might be available today. We posted up top right above that summary information on the loan program that we're announcing with our partners today. You can download this off of the website as well. It's a quick one-page flyer on what this new loan product will be. All of that information is right there. And there is a wonderful ecosystem of small business resource providers here in Louisville. We've got Jennifer Vliba here on the call with us. We've got our partners at GLI and the Small Business Development Center. SBA, folks that navigate, and we've got a small business resource team here at Louisville Forward. So you can get connected through our website and then branch out into any of those service providers who can help walk through what's going to be best for you. We heard our small business owner earlier talking about what's right for her. It's going to be different for each business owner. So we're trying to get stuff out there to help everybody where they are and what they need.
Okay. Thanks for the good work you and your team are doing here. It gives people more peace of mind. As best we can have.
Proud, sir.
All right. Darcy Costello is from the Courier-Journal saying Cincinnati's mayor announced yesterday that the city was furloughing 1,700 of its workers, more than a quarter of its 6,000 workforce. Is Louisville looking at something similar to balance its budget? Not at this time. We had a budget call today with the Metro Council. There's a lot of factors going into this. Obviously, our tax revenues are taking a massive hit right now, and that obviously is how we make our money at Metro, is to collect taxes so that we can then expend the necessary services to protect our city, keep our city clean, et cetera. So right now we have more adequate work for everybody. We've got a very healthy rainy day fund if we need to use that. And then a really critical issue on this is how much money will be coming from the federal government to directly replace the revenues that have been lost by state and local governments. So in the supplemental number 3 of the bill that was passed last Friday, there was relief in there for states and then directly to cities of over 50,000 or 500,000 population, which we're thankfully one of those, and then less to smaller cities that would go through the state. But those funds are right now largely directed toward replacing the expenses that we have to experience because of COVID-19 versus directly replacing the revenue that we've lost because of the economic slowdown. So Congress is already talking about a supplemental number 4. And in that would be this concept of how we can make sure that our local governments are made whole the best they can, because obviously we've got to be healthy as a city government to deliver the services that are required to keep our city safe from the COVID virus. So we're kind of playing that all out. We'll be running we'll be running 2 different budgets, basically. We'll be running a budget where there's no federal relief, and then one where there is federal relief, and maybe one halfway in between, so we can have a couple different scenarios and see how this continues to play out. So Darcy, just kind of keep in touch with us on that, because that'll be changing. Okay, Amina Elahi asked, what actions is Metro taking to acquire more PPE in the case that the amount Louisville needs cannot be acquired through the federal government? So Amina, that is a good question. And as I've talked about several times before, the incident management team is coordinating our whole citywide response to this COVID-19 crisis. And one of the things that they're charged with is making sure that we have adequate PPE for our community. So we're not there yet. We did receive a supply from the federal stockpile. And so we've been handing that out for the request of our healthcare partners throughout the community. Not everything they want, because if it was everything they want, it would be all gone. So we believe that we have 3 weeks supply basically right now, and then we have more coming to us. So we've got a couple different buzzwords we use in this area, and it's to increase availability of critical resources by preserving what we have and by accelerating industrial manufacturing. You're seeing that taking place around the country and the world right now, and then expanding into some new industries. That's why the mayor's called upon President Trump to fully enact the Defense Production Act, and then to make sure we're allocating these appropriately. So the priorities are healthcare facilities with COVID-19 impact, which they all have had by now, nursing homes, long-term senior homes as well, and then our first responders. So everybody has an adequate supply right now, but we're building up for the surge. Here's a good one. Darcy Costello, there have been media reports that Louisville is being considered as a location for the NBA playoffs, potentially in late June. Are you supportive of that idea? And has the city had conversations with the NBA? So if the COVID crisis is passed, it would be awesome to have the NBA playoffs here in Louisville. We have an NBA-ready arena. You've heard me say that many different times. But there are no conversations taking place in my office right now with the NBA. So be exciting if it all happened, but no conversations that we're having right now directly, unless something has come in the last hour or so. Okay. Wave 3 News is asking if there's an update on my self-quarantine. Do I plan to continue to work from home? I'm gonna evaluate that before the day is over. Um, you know, on one hand, I'd like to get out and kind of see what's going on, but what I want to see when I see what's going on is hopefully is nothing's going on. Okay, because we're asking everybody to stay home, knowing that there are some things happening in the city. It's important, obviously, that we continue to send the message, and where I can provide support, I'm going to provide support, whether it's virtually like this or if I'm released from quarantine out in the city as well. So we'll just play that by ear. Has the city received any reports of fake test sites that are scamming people? That's from Bailey Loosemore. We have a report of a test site at, I guess, we're in the Shelby Park area that's charging $240 per person for a test. Okay, you do not need to do that. Okay, and we're watching and monitoring that right now. So they're in town for a limited period of time. We're making sure that they have all the proper authorities to do that. We've heard of that, but can't report anything more on that. If there's anybody else from Metro on this call and can give more information, please feel free to pipe in. Okay, we've Jesse Cohen. We've heard some buzz about EMS, specifically in the Middletown Anchorage area being quarantined. Can you confirm that or provide any details? I do not have any information on that right now. Dr. Moyer, do you?
I don't have information on that right now either. So we'll have to get back to Jesse on that.
Okay.
So Jesse.
Yeah, they're from Bailey. Yeah. And then also, Bailey, we'll get with you on this one. Can you provide specific numbers on first responders across all agencies who've been quarantined and infected? Yes, we have that information and can get that to you. It's a relatively small number. I think we're at, what, Sarah, do you know off the top of your head what that is? It's, I think one police officer, 2 or 3 firefighters. So we'll get that to you, the specific information after that. Fortunately, we have not seen kind of the explosion with our first responders that has happened in other cities. Detroit right now, I know, has a couple hundred. Their police force is about twice the size of ours is, and New York City is over 1,000, but I think they have 33,000 police officers. We have around 1,100, 1,200 police officers in total. Okay. And then one last question from Jesse. LMPD has been discussing the difficulty to enforce people's social distancing. Do you feel a stay-at-home order would make it easier for officers to enforce? What we're trying to do here, folks, is have the community police itself. We have given the order that you only should be going out if you need to go out for essential business or if you're out for exercise, not in a group, staying 6 feet apart. That's just about as far as we can take this without next steps being, a curfew or other restrictive measures, which we really don't want to do, right? I mean, our community should be good enough to come together to figure this out by ourselves. So we're going to give that a couple more days and see how it goes. We saw some signs of hope yesterday. It could be weather related, who knows? But everybody, please just help out here. You heard at the beginning of this call now, we announced 4 additional deaths in the community for 7 deaths, okay? These are folks that could be any of our loved ones. So just please protect yourself so you can protect them as well, all right? That's what we can all do. This is the ultimate team sport we're in right now. It's you, it's your family, it's your community. It's the folks you love against this bad boy COVID-19 that showed up. None of us wanted to show up, but we've got to fight. And the way we can fight is by all doing our part and making sure that everybody else is doing their part as well. When we do that, we'll get through this together, and then we'll be talking about it years away from now saying, I did my part. That's all we can ask anybody. All right. So thanks everybody for joining us for our 4 p.m. media briefing, and we'll see you tomorrow. Take care of yourself. Thank you.